Hey guys, Jeff Lewis from Lewis Physical Therapy and Sports Rehab here. I want to talk to you guys today about the sleeper stretch for pitchers and throwing athletes. First, I want to start off with I never give the sleeper stretch to any pitcher or throwing athlete that comes into our clinic after suffering any type of arm injury. At some point, the sleeper stretch became the go-to for a lot of clinicians where, oh, you have shoulder pain and you also lack shoulder internal rotation. Let's give you the sleeper stretch right away. Now, diving into shoulder internal rotation mobility a little bit. So for throwers, we look at external and internal. So external is the ability to go back, internal is going forward. While internal rotation deficit is definitely something that's important to be aware of, more emphasis in today's day and age is placed on the total range of motion. So what is the total amount of motion between their external versus their internal? And the reason that we prefer total range of motion versus just looking at internal rotation deficit is because the throwing shoulder is different from a non-throwing shoulder. There are bony changes that take place. The posterior capsule and posterior tissue is typically much tighter. Now, what I will say is when we're looking at internal rotation alone, we do want to make sure that there isn't any difference of greater than 15 to 20 degrees of internal rotation on your throwing side compared to your non-throwing side. But it is normal for throwers to have less internal rotation on their throwing side than they do on their non-throwing side. Just like it's normal that throwers are going to have more external rotation on their throwing shoulder compared to their non-throwing shoulder. Again, there's a lot of different reasons that go into that. We briefly touched on that a little bit before in terms of bony structure, other tissue. We're not going to get too much into that for the purpose of today, but I want to go back to the sleeper stretch. So again, the sleeper stretch is very commonly given to throwers that are lacking internal rotation mobility, whether there's a big deficit or not. But the problem with the sleeper stretch, especially if it's a thrower that has pain on the front of their shoulder with throwing, is all you are doing with the sleeper stretch is you are taking all of those structures on the front of the shoulder, you are jamming them together, and then you are asking that shoulder to rotate. For most shoulders, especially one that is painful on the front with throwing, that is not going to feel good. It's probably going to make things more irritated and angry because all you're doing for the sleeper stretch, you're lying on your side here. You have one arm out to the side, and then you're taking your other arm and you're just pushing down. Like, I'll be honest, right now, this already doesn't feel good on my shoulder. Most of the times, guys will be like, oh, wow, I actually can't get that far. And then they'll end up moving through their elbow, their forearm. And at that point, we're not doing really anything for the shoulder other than just not doing the stretch properly. So, again, sleeper stretch. I never give it to any of our pitchers or throwing athletes. I just do not think that the reward is greater than the risk at that point. So you might be asking, well, if you're limited in shoulder internal rotation mobility, what do you do instead to get more mobility back there? A couple different movements that we do that I'm going to go over it, but a lot of these are focusing on addressing that soft tissue structure. Again, the bony changes that occur at the shoulder, that have occurred at the shoulder since their young age when they started throwing, we are likely not going to be reversing that. And a big part of that bony structure, of that bony change and bony structure, is what leads to that internal rotation deficit. But in cases where it becomes excessive, there's usually a lot of deficits in the back of the shoulder from a soft tissue, joint, muscular standpoint. So one of the first things we're going to do is we're going to just grab a foam roller. So you got a foam roller here, and we're going to work on foam rolling the lat and that rotator cuff a little bit. So we're going to go ahead, we're going to lay on our side here. You're going to have one hand down, and you're going to start that foam roller really on the upper part of your rib cage. And then from there, you're going to gradually move up a little bit closer to your armpit. You're going to find that up in the armpit, that is going to be likely the most tender and sore for you, where that lat and teres major come up around there. So you're going to find a spot. You're going to nice and easy just gradually move back and forth, taking a deep breath in and deep breath out. Do that a couple times. Then you're going to find another spot. You might move up a little bit more, move over this way. Same thing. Now, where a lot of guys typically are tighter is when you roll back a little bit. And the reason that is you're going to start getting more onto the rotator cuff, mainly as it comes off of that shoulder blade or scapula. So you can do the same thing there, nice and easy. And out. Breathe in and out. And then you're going to just, again, look for some other spots. One of the important things I tell guys when they're foam rolling is you don't want to go from 0 to 100 right away with the intensity. You want to gradually build into it and let your breathing allow you to relax into it. If you go too much too soon, you're just not going to relax. Everything's going to stay tight, and it's probably just not going to feel good. So next thing you're going to do is you're going to grab a lacrosse ball. And I'm going to use a squat rack here, but you can either use a squat rack, you can use a wall, really any type of sturdy structure. So what you're going to do, you're going to go ahead, you're going to put that lacrosse ball either on the wall or the squat rack there. And then from there, you're going to have one hand resting, and you're just going to roll around the side towards the back of your shoulder. If I'm going to rack here, I'm probably just going to place it back there more than anything. So I'm going to find that spot. Same thing, kind of gradually just moving back and forth, nice and easy over it. And then what I might do is a little pin and stretch. So I find that spot there. I'm moving across my body and back in. Moving across my body, back in. So I might do 5 to 10 reps there. And then I'll add in some external, internal rotation. Just working through that cuff, especially as it comes around the shoulder off the back of that shoulder blade. So those are 2 things that we'll do to start. And then after that, we're going to work on more of just some tissue flexibility, letting that shoulder relax. So what you'll do here, you can use a resistance band. I would say the heavier, the better. You don't want to get a super light one because you're not going to get as much distraction from there, but you're going to have your palm through here. I sometimes like to wrap my hand around and get a little bit more tension. And then from here, I'm just going to focus on just sitting back. So I'm not just falling into it. I'm more so sitting my hip back and letting that band pull my arm up. I'm going to sit back down here, and this should be all felt down through the side of that shoulder, that armpit there a little bit. Taking deep breaths in and out. Deep breath in and out. And after I do that for about 30 seconds, then I'm going to turn my trunk. My arm stays in the same position. I'm going to turn my trunk to the opposite direction to start biasing a little bit more on the back of that shoulder and back of that shoulder blade. So I'm going to be here. And then I'm going to turn up. Again, I'm not moving my whole body. You're going to immediately lose tension for everything. I'm here, and I'm turning my body up, and same thing. Breathing into it, and out. Breathing into it, and out. So those are some of my go-to movements that I will do in place of the sleeper stretch. Again, the sleeper stretch, in my opinion, the risk is not greater than the reward. Whether you have pain when you're doing it, or if you're even not having pain, there's better ways to go about it that aren't going to be put as much pressure and irritation on the front of that shoulder. So if you're currently dealing with some shoulder pain, or you were given some exercise, you're not sure if they're working for you, you're looking for some more guidance, feel free to check out some of our resources below or comment on this video. Let us know what you're looking for, and we'll get some stuff put together.